Hi, my name is Michelle. I'm a paramedic with American Medical Response. Today I'm going to demonstrate how to perform the physical exam of a spinal assessment. When properly done, a spine injury assessment can help rescuers decide if spine stabilization is needed or not. In this video, we will demonstrate the nexus exam. If the patient passes all parts of the exam, the spine is clear and no spine stabilization is needed. Hi, my name is Michelle. I'm a paramedic with American Medical Response. Today I'm going to demonstrate how to perform the physical exam of a spinal assessment. When properly done, a spine injury assessment can help rescuers decide if spine stabilization is needed or not. In this video, we will demonstrate the nexus exam. If the patient passes all parts of the exam, the spine is clear and no spine stabilization is needed. In this video, we will assume that the patient has a clear mental status, is not intoxicated, and has no distracting injuries. Spine clearance is approved by the Michigan EMS protocol, and specifically the nexus exam is approved by Dr. Chassie for all CHEMS agencies from MFR to paramedic. Because I have a calm and cooperative patient, rather than have someone hold his head, I will simply ask him to keep his head nice and still for me. I'm going to demonstrate the physical portion of the spinal exam. I'm looking for any potential injury to the spinal column or the spinal cord. This can be done in any order, but I'm going to start by palpating the spine. Sir, I'm going to check your neck and back for any potential injuries. I need you to tell me if anything hurts as I touch it, okay?
Okay.
Alright, can you turn around for me a minute? So I'm going to start at the top of the neck, feeling each spine's process for any tenderness. Any pain with that?
No.
Still good?
Mm-hmm.
No pain there?
No.
Okay. I'm going to stop at the waistline because that's about the area where the spinal cord ends, and that's the area we're most concerned about. Next, I will demonstrate the motor and sensory part of the exam. For the sensory portion of the exam, I need the patient to be able to distinguish between sharp and dull on all four extremities. This is the toughest part of the exam. For my sharp object, I'm going to use the edge of a paper clip and then the side for the dull. You could also use a mechanical pencil or potentially a toothpick for your sharp object. I'll explain to the patient on his forehead the difference between each, because that would not be affected by any potential spine injury. Sir, keep your head nice and still for me, and I need you to tell me the difference without looking if this is sharp or dull. I'm going to explain it to you first on your forehead. Can you feel this okay?
Yes.
Is that sharp or dull?
That's sharp.
And is this sharp or dull?
Dull.
Okay. For the sensory part of the exam, I need the patient to be able to distinguish between sharp and dull. I'm going to use the lateral aspect of the hand as that will test the lowest dermatome. So without looking, I need you to tell me if this is sharp or dull.
Sharp.
Good. And is this sharp or dull?
That is dull.
Good. And same thing on this side, sharp or dull?
Sharp.
Sharp or dull?
Dull.
Good. For the sensory portion of the lower extremity, I can go on the lateral aspect of the foot, or to avoid removing his shoes, I can go on the lateral portion of the lower leg because that's the same dermatome. Sir, without looking, I need you to tell me, is this sharp or dull?
That's sharp.
Good. And is this sharp or dull?
That's dull.
Good. Same thing on the other side. Is this sharp or dull?
That's sharp.
And is this sharp or dull?
Dull.
Good. Next I will demonstrate the motor exam on all four extremities. Sir, can you spread your fingers out for me? Keep them apart for me and don't let me push them together. Good. And it should feel like tight springs as I do this. Good. If the patient's unable to do that, you could also have them flex their wrist. Sir, don't let me straighten it out. Good. And flex this one and don't let me straighten it. Good. For the motor portion of the lower extremities, I'm going to ask the patient to lift up his foot. Good. And push down like a gas pedal. And lift this foot. Good. And push down. Determine that our patient has a clear mental status, is not intoxicated, and has no distracting injuries. He had no pain upon palpation of his spine, and he had no motor or sensory deficits. His spine is now clear, and he requires no immobilization. If the patient has an altered mental status, is intoxicated, has a distracting injury, has tenderness upon palpation of the spine, or has a motor sensory deficit, the spine cannot be cleared and the patient must be immobilized.